Hi, welcome to TLC Academy. My name is Ann Blackburn and I am a nurse case manager in the West Lebanon office. Today's topic is managing bowel and bladder incontinence. Managing bowel and bladder incontinence in home care does not need to be difficult. There are actually 5 different types of bladder incontinence. The first type is stress incontinence. This is leaking urine when you laugh, cough, sneeze, lift heavy objects, or do anything that puts pressure on your bladder. Functional incontinence is when a medical condition like arthritis or MS keeps you from getting to the bathroom in time. Urge incontinence is also known as an overactive bladder, and in this type you leak urine after having a sudden strong urge to go. You may have overactive bladder if you urinate more than 8 times during the day and get up at least once during the night. You may also feel the need to go when you hear running water. There's a mixed incontinence, which happens when you have both stress and urge incontinence, and this is much more common in women. Overflow incontinence is when you are not fully able to empty your bladder and you leak urine when your bladder is full. There are lots of different causes of bladder incontinence, and some of the causes could be pregnancy, childbirth, menopause, medications, UTIs, prostate issues, smoking, being overweight, and medical issues like diabetes and Parkinson's disease or having a hysterectomy. There's all sorts of treatments for bladder incontinence out there. Both men and women can use incontinence products such as poise pads or Depends, pull-ups, panty liners, diapers, or they can just change their undergarments when wet or soiled. There are even washable underwear with thick padding in it for those that are concerned about the environmental impact of the disposable products. If you have overactive bladder, your doctor may prescribe different medications for you, and these will help decrease the feeling of needing to go. These come under many different names like oxybutynin, Myrbetriq, Vesicare, Detrol, etc. But all medications come with side effects, and the client may need to decide if the benefits of the medications outweigh the side effects that they are experiencing. Another non-invasive thing to try is bladder retraining. This involves toileting the client every 2 hours when awake. Place them on the toilet or the commode every 2 hours, even if they say they don't need to go. The whole idea is to gradually increase the time between trips to urinate. It can take between 3 and 12 weeks to properly retrain the bladder. You may be asked to help them keep a bladder diary, and the basic information that would be included in this is if they were wet or dry, how much they've urinated, and how frequently they're going. So you would put, 2 p.m. dry, 300 cc's. It could be, and then after that would be 4 p.m. didn't void, was wet. So this is the basic kind of information that they would be looking for. And it's important to be as accurate as possible with this information. Keeping a bladder diary may show you your client is only incontinent at specific times of the day, like first thing in the morning or just before they go to bed at night. A general rule of thumb is that the client should be toileted upon awakening, before bed, and at least every 2 to 3 hours in between. Another thing that can be done is to figure out how often you use the bathroom. Next, set a goal to increase the time between your bathroom visits, even by a little. So if you go every hour, try to stretch that out to 1 hour and 15 minutes, and then gradually add more and more time between your trips to the bathroom. As you start to train your bladder, try to go at scheduled times. Stick to your schedule, even if you feel the urge to go sooner or don't go at all. If you have the urge to use the bathroom and it is not the time you have planned, try focusing your attention on a complex mental task. This could be reciting all the words to a childhood song, Or practice giving directions to your house from different locations. Or even better, you could try counting backwards from 99 by 3s or 7s for an even bigger challenge. Limit your fluids before bed. Stop drinking about 2 hours before going to bed for the night. Avoid alcohol, tea, coffee, soda, caffeine, and artificial sweeteners. Good skin care is very important after each incontinence episode. Weight loss will also help incontinence as well as quitting smoking. Some doctors have recommended Botox injections, or they may elect to perform surgery to repair the issue, like the surgeries listed below. A bladder sling is where the strips of your body's tissues and synthetic material or mesh are used to create a pelvic sling around your urethra and the area of thickened muscles that where the bladder connects. The sling helps keep the urethra closed partially when you cough or when you sneeze. There's a bladder neck suspension surgery, and that is designed to provide support to the urethra and bladder neck. Prolapse surgery. When there is a prolapsed bladder or the musculature that helps support your bladder, and they help resuspend that and reinforce it so it doesn't prolapse anymore. And for men, they actually have a device called the Penile Clamp, and this can be used, and it's an actual clamp that goes over the penis, or an implantation of an artificial sphincter around the urethra, which is inflated and deflated by a device implanted under the skin. Another non-invasive thing to do are Kegel exercises. They can prevent or control urinary incontinence and other pelvic floor problems. Kegel exercises strengthen the pelvic floor muscles which support the urethra, bladder, small intestine, and rectum. You can do Kegel exercises just about any time, anywhere. How to do Kegel exercises is very important to know. You need to find the right muscles, because if you're exercising the wrong muscles, it's not going to be helpful. So to identify your pelvic floor muscles, you stop urination in midstream. And once you've identified that those are your pelvic floor muscles, you can do the exercises in any position, although you may find it easier to do them lying down at first. You need to perfect your technique. To do Kegels, imagine you are sitting on a marble and tighten your pelvic muscles as if you're trying to lift the marble. Try it for 3 seconds at a time and then relax for a count of 3. You need to maintain your focus. For best results, focus on tightening only the pelvic floor muscles. Be careful not to flex the muscles in your abdomen, thighs, or buttocks. Avoid holding your breath. Instead, breathe freely during the exercises. You should repeat these at least 3 times a day. Aim for at least 3 sets of 10 to 15 repetitions a day. Do not make a habit of using the Kegel exercises to start and stop your urine stream, because doing that while emptying your bladder could also lead to incomplete emptying of your bladder, and that would increase your chances of developing a urinary tract infection. If the Kegel exercises are done regularly, you can expect results such as less frequent urine leakage within a few weeks to a few months. As you can see, there are multiple methods of managing bladder incontinence. But the whole thing is to keep the exercises up, because once you stop easing them up, you lose the benefit of it. Bowel incontinence can be as distressing as bladder incontinence, or sometimes even worse. Nearly 18 million adults in the U.S. have bowel incontinence. A visit to the doctor is the start of treatment. The doctor will do a thorough history and physical, and further testing may be ordered. The test may include an MRI, a colonoscopy, rectal exam, and anal manometry, which checks the tightness of your anal sphincter muscle, and an anal-rectal ultrasound. Different causes of bowel incontinence are very similar to bladder incontinence: childbirth, hemorrhoids, medications, medical conditions like irritable bowel syndrome and inflammatory bowel disease. nerve damage caused by multiple sclerosis and diabetes, muscle damage or weakness, and diarrhea or constipation. Sometimes medications are all that's needed to help stop bowel incontinence. Anti-diarrhea medications like Lomotil or Imodium are used. But interestingly enough, a bulk laxative like Metamucil may also be used to thicken the stool. If muscle damage is causing fecal incontinence, your doctor may recommend a program of exercise and other therapies to restore muscle strength. These treatments can improve anal sphincter control and make you more aware of the urge to defecate. Similar to bladder retraining, bowel retraining can be done by trying to make a conscious effort to have a bowel movement at a specific time of day, particularly like after eating. Establishing when you need to use the toilet can help you gain better control. There's something called TENS, or a sacral nerve stimulator, and this device sends small electrical impulses continuously to the nerves in the spinal cord, and that can help strengthen your bowel muscles. But this is not the first line of treatment. Usually surgery is a last resort. If the issues are caused by a weakened anal sphincter, surgery can be done to tighten the sphincter. The doctor can also implant an artificial sphincter that is inflated or deflated by a small external pump. A colostomy or ileostomy is done by diverting the bowel to an opening on the abdomen where the stool is collected in a special bag. Usually this type of surgery is definitely a last resort. Sometimes it's only temporary, but sometimes it is permanent. Protecting the skin is very important. Stool that is loose is contains a lot of acids in it, and it's very irritating to the skin. Wash the skin gently with warm water after each bowel movement. Dry thoroughly and apply some type of barrier cream like a Desitin or a vitamin A and D ointment. And there's something called butt paste. So there's certainly lots of products out there. Use what is the most comfortable for you. And very importantly, you should always carry a change of clothing and incontinence products with you when you go out. You should know where the bathrooms are located in case you need to find one in a hurry. And use the bathroom before you leave the home. And another good thing is there are lots of support groups out there in the community. An example of one that might be helpful for you is the National Association for Incontinence. That's the end of today's program, and I'd like to thank you for attending. And once again, TLC Academy is online for your benefit. Have a good day.